have another session with Dr. Selva Shunmugam. Our Vice President will give a brief introduction of Dr. Selva Shunmugam.
Um,
Rama, can you open your camera?
I was thinking of not showing me. Thank you, Dr. Dr. Anand. Your whatever you gave was extremely precious and very dear to our hearts. And hopefully, a lot of people will reach out, whoever's having any this kind of issues to you. And if anyone needs to contact Dr. Anand, please email us at gcsmr20@gmail.com, and we will make sure that you get the contact details from us. Thank you very much again, Dr. Anand. Again, it's extremely great that we have you today this morning. Next, I'm going to, it's my pleasure to introduce Dr. Selva Shunmugam. I've known him for more than 10 years now. And before starting, above all, he's a great human being. With that, he's a great Siddha doctor, and he's a secretary of Siddha Consultant of Health India Foundation Clinic for Integrated Siddha and Modern Medicine at Chennai. And he's also president and founder member of World Siddha Trust. He's been contributing to Siddha system for more than 20 years. And his experience is always connecting Siddha and modern medicine in an integrative approach way. And one of his hallmark awards, or I would say his projects, is he coordinated a WHO-sponsored project entitled Development and Publication of Siddha Treatment Guidelines for Selected Diseases. And as a principal investigator, he analyzed medical and health-related yoga concepts of Tirumandiram, a Tamil-based ancient literature. Currently, he's, as he mentioned previously, as the president of GCSMR mentioned, he is decoding and translating the works of Siddhas into English under the I'm sorry, someone was requesting. We are not allowing anyone to record. We are recording it, and it will be uploaded in our website. So please don't ask for any permission. Thank you. Sorry for the interruption. Under the funding of Central Institute of Classical Tamil, Government of India, and therapeutic effect of Siddha medicine in hypertension patients, a randomized controlled trial, is been approved by IEC, Department of Health, Government of Tamil Nadu, and Clinical Registry of India. And he had also got the honor of presenting inaugural integrated medicine lecture at Department of Community Health and Preventive Medicine at Morehouse School of Medicine, Atlanta. He was also awarded Certificate of Appreciation for the same in 2016. So all these basic things led to a lot of developments, and currently that's what led to the current accomplishment or a milestone related to Siddha medicine courses that has been added to the accredited program at Morehouse School of Medicine, Atlanta. And as the president, Sivasailam, mentioned earlier, they're having 3 Siddha medicine courses. It's recognized at the Morehouse School of Medicine for the medical students studying in America. And they're given an excellent opportunity to go to India to study Siddha medicine as an elective course. And this year, 4 medical students are going to India soon to study the wealth of Siddha. And Dr. Selva has presented a lot of research papers at national and international conferences. And also the most important award is the Central Council of Research in Siddha Ministry of Ayush that he's been appointed recently. And his role in GCSMR is tremendous. I don't have words to express and we are happy that he is one of the roots of GCSMR. Now, I invite him to share his expertise about fasting and heart health based on traditional Siddha medicine, which has strong roots in Tamil Nadu. Welcome, Dr. Selva.
Thank you, Dr. Rama, for introducing me. And thank you, Dr. Anand, for giving a very excellent lecture in this webinar. Thank you, the President and the Secretary of Global Center for Siddha Medicine and Research. So I would like to share some Siddha approach for fasting and heart health related with Dr. Anand's lecture. So, ever wondered what people like Thiruvalluvar, Tolkapiyar, and other ancient Siddhas ate? We are talking about a period of 5,000 years ago, and we can't look into a kitchen of the time. But the innumerable Tamil literatures and archaeological reports can take us back in time to understand what ancient food was like. So today's topic is fasting and heart health and integrative approach. Why do we choose this topic today? Dr. Anand clearly explained the topic very nice manner with clinical evidences. I am going to discuss some Siddha approaches to curb food craving, prevent heart disease, and some other
Mute your phone. Can you please mute your phone?
So thank you. I am going to discuss the Siddha approaches to curb food cravings, prevent heart disease, and some other challenging conditions. So it is very difficult to give a dietary advice to food addicts in the hospitals. It is very difficult. All the physicians should know. So over restrictions, that is over restrictions of food intake can lead to relapse and to over. Instead of eating more of right food can help reduce hunger and food cravings throughout the day. We are going to see some strategies for overcoming the overeating. Eating unconsciously or mechanically leads to disease state, and eating consciously can reverse it. Before seeing the Siddha approaches, we need to know the Thirukural concepts of food. I would like to say some 4 Thirukurals. Marundana vendavam yakkaiku arundiyadu atrathu potri unin. It means eat food that are compatible with the body. If the food digested and mixed with the body and the food is eaten consciously, the body does not need medicines. This is one of the important preventive method, important primordial preventive methods mentioned in the Thirukural way back. The second one is the Atral Alavarindu Unga Agdudambu Petron Nedituikum Aru. The meaning is, if you know the what you have eaten before has digested, estimate the amount of food and eat for the future needs. Eating in moderation is important way to providing the life of the body and soul. The next Thirukural is Atrathu Arindu Kadaipidithu Maralla Thuikatthuvara Pasithu. The meaning is, in this Kural, Thiruvalluvar emphasized the compatible diet in this Kural. So conscious eat food that suits our body when we are hungry. It paves the way for the disease-free life. The last Thirukural is Ilivarindu Unbankan Inbam Pol Nirkum Kaliper Irayankan Noi. One who knows the required amount of food and eat consciously does not lose pleasure. A person who swallows too much without knowing the amount of it become ill. So we are giving the some conscious eating method in our program. The conscious eating is a 5 sense organ eating with eyes and other all sense organs. So eat without distraction is very, very important. No mobile phones, no TV, no work during the eating, no computer, no newspapers, smartphone. Don't eat while driving or working at your desk. These are all the basic concept of the conscious eating. So we are going to see some Siddha ways to suppress appetite. So Dr. Anand clearly explained about the clinical background and the research-based evidences, but Siddha ways to suppress appetite is very, very important for this session. So the first concept, the suppress the appetite. Eat more protein and healthy fats. So the first one is peanut sudal, boiled peanut sudal with boiled peanut with the grated coconut, boiled nuts, sprouted green gram, ghee, buttermilk, and cold pressed sesame oil and other vegetable oils. What is the background? So the appetite suppressant and the GLP-1 stimulating effect of whey protein in obese subjects are associated with the increasing circulating levels of specific amino acids. This is the published paper. In this paper, it clearly states that some specific amino acids, isoleucine, leucines, lysines, and other amino acids are implied in the appetite suppressants and the GLP-1 stimulating effect of whey proteins, which may be mediated by their binding with nutrient sensitizing receptor expressed by the enteroendocrine cells within the gastrointestinal tract. So consuming more protein and healthy fat suppresses the appetite without affecting the general health. So these are all the things. So proteins and healthy fats are very, very important for suppressing the appetite. The second primordial preventive concept of Siddha system is pre-meal herbal water consumption. The first one is the cumin seed herbal water. The second one is the tulasi herbal water. The third one is the mint and lemon herbal water. The fourth one is the cucumber and lime lemon water. These are all some examples. These are all some examples for pre-meal herbal water. So what the science says. Some scientific recent research scientists analyzed pre-meal water consumption and energy intake and satiety non-obese young adults. So in the conclusions, pre-meal water consumption lead to significant reduction in meal energy intake in the young, suggest that this may be effective weight control strategy, even though mechanism of action remains unknown. So use this type of herbal water before eating the meal is very good. That is suppressing the appetite. The next concept is fiber food. That is the greens, vegetables, black grams porridge, and raw vegetable salads and the sprouts. So these are all the fiber foods. So dietary fiber in prevention of the obesity and obesity related chronic diseases. So what the researchers says, dietary fibers may act via pathways involving GPRS, HDAZ, and aromatase enzymes pathway. Ultimately, fiber intake contributes to improve glucose levels and insulin sensitivity, lowering the risk of type 2 diabetes mellitus and cardiovascular diseases. Therefore, Diets rich in dietary fibers should be encouraged to prevent obesity and associated chronic diseases like metabolic syndrome and some other cancers. So dietary fibers includes greens, vegetables, whole grains, porridge, sprouted methi, that is a sprouted fenugreek, as well as the fresh vegetables with buttermilk. This is a very good fiber foods mentioned in the ancient Siddha literature. The next concept is the medicinal seeds. The first one is the moringa seed. The second one is the flax seed. Third is pumpkin seed. The fourth one is the cucumber seed. The moringa seed, shade dried and powdered mixed with the honey, is a very good effective in suppressing the appetite. The second one is the flax seed sweet ball. The third one is the pumpkin seed fried with the clarified butter, that is a ghee. The fourth one is the cucumber seed in a raw. These are all the very good appetite suppressants. So what's the current science says? Several studies have found positive significant effects on fullness and satiety. There are limited number of documents related to the effect of flaxseed. In Tamil, it is called alisi vidai. In English, flaxseed or linseed. So this available studies suggest that the potential role of flaxseed in decreasing the appetite and hunger. So it is published in the peer-reviewed journal. The next important thing is pranayama before food. So various types of pranayama mentioned in the ancient Siddha literature, especially in the Tirumular Tirumandram. So conscious breathing, Om pranayamam, Nadi Suti pranayamam, that is otherwise called as alternate nostril pranayamam, Purana Suti pranayamam. So you all well known about the conscious breathing. This is otherwise called as abdominal breathing. Om pranayamam or hum pranayamam or tumbi pranayamam in Tamil. That is Nadi Suti pranayamam. That is the Puraham. Inhalation 6 seconds. Kumbhakam. Retention 1 second. And exhalation 12 seconds. 1:2 ratio inhalation and exhalation. So before food, during this pranayamam will help. One study stated that breathing exercise, that is controlled breathing exercise, provides comfort in different circumstances, such as lack of regular meals, limited volume or caloric diet, even during the temporary complete abstinence of food in the therapeutic fasting level, what Dr. Anand mentioned in his study. So pranayamam or breathing exercise, controlled breathing exercise, is helpful in controlling the appetite. So fresh ginger, dried ginger, and chebulic myrobalan, that is the inji, chukku, kadukai. This is the kaya kalpam mentioned in the ancient Siddha literature. Kalayil inji, kadumbakal chukku, malayil kadukai, mandalam unduvara, kolai undri nadakkum kilavarum, kolai viduthu kulavi nadapare. There is early morning, take ginger elixir. Before lunch, take dry ginger elixir. In the evening, take the chebulic myrobalan, that is a kadukai kaya kalpam. So these are all some simple preparation. Fresh ginger elixir. How do we prepare? Remove the skin from the ginger and fry it in the clarified butter ghee. Soak it in the honey. The dosage is 1 teaspoon once a day. The ideal time for taking this fresh ginger elixir is 5 a.m. to 6 a.m. So once a day is enough. The second one is the dried ginger elixir. Soak dried ginger in the lime water for an hour. Then dry under the sunlight. Remove the skin and grind. Powder the mixture with an equal amount of palm jaggery. With this mixture, take 1 teaspoon. The ideal time for taking this elixir is 11 a.m. The last one is the Chebulic myrobalan elixir, that is Kadukkai Kayakalpam. Boil the Kadukkai in the milk for 15 minutes, dry in it sunlight for 3 days, and then remove the seeds and grind it. The dosage is 1 teaspoon with honey. The ideal time is 7 p.m. So, Kalayil Inji, Kadumbahal Chukku, Malayil Kadukkai. This is mentioned in the ancient Siddha literature. So, current science. The ginger consumption enhances the thermic effect of the food and promotes the feeling of satiety without affecting the metabolic and hormonal parameters in overweight men. So, the results suggest a positive role in ginger in weight management. This report shows improved thermogenesis and feeling of hunger with the ginger consumption. Satiety and fullness were higher in ginger treated group compared to control group. This is the randomized controlled trial. So satiety and fullness were higher in ginger treated group with controlled with the compared with the control group. So this is very good combination. Kalai Linchi, there is early morning ginger. Around 11 o'clock, Chukku Kalpam, that is a dried ginger elixir. In the evening, Kadukkai Kalpam, that is a myrobalan, Chebulic myrobalan elixir. So next we are going to see some Siddha superfood to choose during the fasting. So we give specific diet advice and specific superfood choose during the fasting, along with heart disease and diabetes, heart disease with hypertension, heart disease with the kidney failure. We are giving some specific Siddha superfoods in tailor-made way. So we are going to give see some Siddha superfoods. The first one is the Panjamutti Kanji 5-grain porridge. The ingredients are black gram, dur dal, rice, green gram, chickpeas. Take all these grains, equal quantities, each 10 grams, and wrap them in a cotton cloth. Add 1 liter of water. So each 10 grams, add 1 liter of water. Boil with 1 liter of water in a low flame. Then take it down after 20 minutes. This porridge is very effective in overcoming many diseases, especially in the type 2 diabetes mellitus and obesity with some heart ailments, especially congestive cardiac failure conditions. So Panjamutti Kanji is very famous in South India, especially in Tamil Nadu. So next one is the Annapudi. So the ingredients are curry leaf, dry ginger, thymol seed, asafoetida, cumin seed, pepper, and fennel seed. Karuvepilai, chukku, omam, perungayam, seeragam, milagu, and last one is sombu in Tamil. So all the ingredients are very good for overcoming many diseases. So equal quantity of this shade dried and powdered mixture is mixed with rice or sir, please mute yourself.
Can you mute your phone, please? Kindly mute your phone, please.
No, I have muted.
Okay, thank you, Tamre. So this Annapudi is mixed with hot water or buttermilk, or even you can mix with rice and add 1 teaspoon of ghee or clarified butter. It is very good for overcoming many diseases. This is considered as a superfood as per Siddha literature. The next one is a specific superfood for the heart. That is a Marudam Thenir, Terminalia Arjuna bark herbal tea. The combinations are Terminalia Arjuna bark. In Tamil, it is called as a Marudam Pattai. In Sanskrit, it is called as Arjuna. Terminalia Chebula, that is a Terminalia Arjuna bark powder 1 teaspoon, rose flower 5 gram, dried ginger, half teaspoon, black cumin seed, half teaspoon, pepper, quarter teaspoon, cardamom, 1. These are all the 6 ingredients. So mix all the ingredients in 400 ml of water and boil it down to the 100 ml of 100 ml. The dosage is 100 ml twice a day. This is very good superfood for heart health. This is another Idaya Avildam, that is a white lotus heart elixir. The ingredients are rose flower, hibiscus flower, and white lotus flower, palm jaggery, honey. Prepare it as like gulkando, shade dried the flowers, mix with palm jaggery and honey, and use it as an elixir. 1 teaspoon twice a day enhances the heart function, cardiovascular system, and also the it is effective in the brain functions. It also effective in reducing the stress also. So these are all some superfood. So I would like to finish with the Tirumandram. So Andam Suringil Adarkor Alivillai, Pindam Suringil Pranan Nileberum, Undi Suringil Ubayam Palavula, Kandam Karutha Kabaliyum Ame. This is mentioned in the Tirumular Tirumandram. So shrinking testicles and ovaries. The meaning is the shrinking testicles and ovaries due to abstinence from the common sexual pleasure can lead to longevity. So, since sperm is fundamental biomarker of male health, so excessive sperm loss leads to shortened lifespan for men. According to the recent research, during the sexual act, seminal fluid stimulates the egg production and reduces the longevity of female. So shrinking testicles, Andam Suringil means shrinking testicles and ovaries due to the abstinence from the common sexual pleasure can lead to longevity. Pindam Suringil Pranan Nileberum. If the physical body or gross body shrinks through yogic practices, the flow of life energy is regularized in the exact energy pathway. The third line, Undi Suringil Ubayam Pala Ula. This is closely related with this session. Reducing the food intake through yoga practices has many benefits that promote superior energy level. This is called as primordial prevention of diseases mentioned in the ancient Siddha literature. By this, we can attain the divine status. So, at this juncture, I conclude my topic. And if you have any doubts or any clarifications, would like to share our experience and answer your questions. Thank you for your kind attention. Thank you so much.